so many of these words are trigger words. Natural, woman. Okay, the truth is, in induction, yes, may be manipulating our bodies to go into labor, but ultimately you are still having the goal of trying to have a nice, normal vaginal delivery, which itself is still just as beautiful as if you came into your own labor. In my opinion, you're still you can still attempt to achieve that goal. But to answer your question about how we get there, okay, membrane sweeping, let's start there. Membrane sweeping involves basically having your physician or provider while they're doing an exam, the same approach we take in checking to see if you're dilated with our hands, you stop and pause. And essentially, I always call it massaging the baby's head, because the head is covered by the amniotic membrane. And if you massage it and create and highlight the space between that membrane and the cervix, there's a space there that we massage. It's called membrane sweeping. Doctors will do this for various reasons in the office, and it is something you can just do in the office. But it can be considered to be part of an induction, but in our eyes, in all honesty, it's not listed as a method of induction. What it does is it encourages the cervix to consider going into labor on its own. And it may work. And if it does, I tell people it can work as quickly as 24 hours from the time it was done, or maybe 48 hours, or it just doesn't. So it's a situation where we encourage, but it really honestly depends on the cervix and whether they're ready to go into labor. And in my practice, I find it more successful for patients who've already had a baby. Their cervix responds better, but it's an encouragement, but definitely not considered an induction. Inductions can be done. Induction approaches can be looked at as medical versus non-medical. Okay, non-medical approaches, so things that it can be done without medication. One, there is a new product, fairly new product that's called Dilapan. I have to look this up, but I'm pretty sure it's called Dilapan. But it's a take on the old approach that we used to do, which was use actually these little sticks that were covered with seaweed. But now they've just placed a new agent on there, but you place it in the cervix and it actually absorbs vaginal discharge and expands over hours. So it's not really having a patient take medication, and it's considered to be a dilator. The FDA actually approved this to be done at home. So your doctor can place this in the office. You can go home if you chose to, and of course follow up, based on what they suggest. But that's one approach that you can take that's starting to pick up. What is more traditional that we do in the hospital is place a little balloon. That's also a mechanical dilator. And that can be placed in the cervix, and after a certain number of hours, you remove it, and it can get the patient to be dilated. And then, of course, there's breaking the bag of water, what we say, or rupturing the amniotic membrane. Now, when you use these, why you use these, who you use these for, involve a great deal of conversation, because not every patient's going to be happy going home with those sticks in the cervix. Not every patient's going to be a good candidate for having their membrane or their bag ruptured right when they come to the hospital. When it's used is really up to the physician and when it's appropriate. But medications that are used, those come in three forms, basically. There's a tablet called Cytotec that can be placed vaginally or orally. There's a placard called Cervidil that you can be placed vaginally. And then there's IV medication, the traditional Pitocin. And that's another heavy hitter in terms of how it resonates with people when we talk about Pitocin, because I feel like the more traditional stories of people having these sort of not so pleasant induction experiences oftentimes involve remembering what Pitocin felt like and how strong it felt and how awful it was. And that creates the ripples in the community of remembering it as not being the best experience. But Pitocin also can be a friend, not an enemy, if used appropriately and at the right time. It really is something that should also have its own discussion, so people understand that, yeah, it can be an effective medication and also one that can create issues if it's not used appropriately. So each and every part of these elements have their place, and if done patiently and cautiously, can lead to high chances of success.